Hi, I am Dr. Sid, and I am the clinic director at Scoliosis NYC. Many patients and parents ask questions about spinal surgery and the use of titanium rods, especially in procedures like spinal fusion for scoliosis. In this video, I will explain what titanium rods are, why they are used, and what patients should understand about possible long-term considerations. Spinal surgery, especially spinal fusion, often uses titanium rods to help correct spinal deformities. These rods are designed to stabilize the spine, reduce abnormal motion, and support healing after surgery. Doctors commonly use titanium because it is strong, lightweight, and generally well tolerated by the body. Titanium is less likely to trigger rejection and works well for long-term spinal support. During surgery, titanium rods are placed along the spine and secured with screws and bone grafts. This creates a stable internal framework that allows the spine to heal, fuse, and maintain alignment. The rods function like internal splints. They limit motion in the treated area, which helps promote bone fusion and can reduce pain caused by spinal instability. While titanium rods are widely used and often effective, it is important to understand that long-term considerations can exist. Changes in spinal mobility, stress on nearby segments, and individual healing responses can all influence outcomes over time. Titanium is not the only material used in spinal surgery. Other options, such as stainless steel or cobalt chrome rods, may be selected depending on the patient needs, the surgeon preference, and the specific scoliosis pattern being treated. The choice of surgical hardware is always individualized. Factors such as age curve, severity, bone health, and long-term goals all play a role in determining the most appropriate approach. At Scoliosis, we believe it is important for patients and families to fully understand both surgical and non-surgical options when making scoliosis care decisions. Informed decisions lead to better long-term outcomes. To learn more, read our full article at the link in the description.